yourself?
My name is Mutiara. I'm 20 years old. I just graduated from nursing at Poltekkes Tasikmalaya in Cirebon. I do not work experience, but previously I have practiced a clinic in Arzawinangun Regional Hospital in the infection room and also had been in the central surgery room for 3 weeks. I have the ability to well work with a team and also do professional nursing care ability and interested to become a nursing staff in the infection room in this hospital. I want to differ into my ability and get more opportunity are my reason why I want to work in this hospital.
Why did you decide on a career as a nurse?
As a nurse because I could help a lot of people. I also show that nurses throughout their lives could provide many benefits for others. Those are the reason why I want to be a nurse.
Tell me what you feel your greatest skill as a nurse is?
Ability to replace wound dressing by applying a sterile concept. In variation to treat wounds, I always stick to the sterile concept so that the wound that I treat does not cause infection and can speed healing. I have experience in treating burns that always apply to concept of sterile and the healing results are very good. A lot of dead tissue can grow back.
What do you find is the hardest part about being a nurse?
Thing about being a nurse is when I cannot do anything when my patient complains of pain. Even though there I have taken action, but it still cannot reach the patient. And also the most difficult thing is when I face critical patient. There I have taken action according to existing procedure and have given up all my abilities, but I cannot save his life.
How do you handle the stress of the job?
I deal with stress at work is that I have to know what causes me the experience stress at work. After which I can try to begin to eliminate the cause of stress. In addition, I must also be able to determine priorities where work must to be priorities so that I can enjoy working. Sometimes I also have to enjoy some entertainment so that I am not too serious in thinking about the problem at hand.
How you interact with doctor and other nurse?
Communicate well with doctors and other nurses in provide care service to patients such as giving medicines to patients. Doctors will provide care such as giving injection drugs that have been delegated to me. So I have to do it well and then record the result of the administration of drugs that have been done, then the report into the doctors.
How will you prioritize the following? A patient complaining of shortness of breath or a vomiting patient? Why?
Prioritize patients who are short of breath because this patient will experience lack of oxygen in his body, which will endanger the patient's basic human needs. According to Maslow, oxygen needs are the main needs that must be met. So I have to put the breathless patient first.
Was the most memorable experience during your career in the nursing profession?
Experience was when I was able to provide care well and managed to provide comfort to the patient, such as when the patient I was handling had to get into bed there. I had to give more attention and assistance, such as helping bed in the bed, so that the patient felt fresher. Seeing patient feel comfortable and thanking me for caring for them
It is a pride for me and also a motivation for me to continue to provide comfort for them. Why do you want to work here? Port Hospital is one of the best hospitals in Singapore that has very adequate equipment and complete facilities. So I want to further develop my abilities in this hospital. To my knowledge, this hospital is also one of the 10 best hospitals in Singapore. Why should we hear you? Ritwo is very concerned with operation standard in taking every action. I am also very careful in doing work to procedure the best result. In addition, this hospital provides complete service and equipment so that I can develop my ability to become a nurse so that I fit into the position.